Good morning, everyone. I'm Perry Smith. I'm a neurologist. I am the stroke medical director of Shady Grove Medical Center. It'll be 10 years coming this July 1st that I've been here. Typically start our day here, and we just bring up the films from overnight. We look at CAT scans and MRIs and just see what was done. Oh, all right. I just got news about a patient who had surgery on Monday, and it turns out it is not a tumor, so that is good news. And then I've got a very interesting patient who has a limbic encephalitis that we're treating, who's doing very well, and so we're getting an MRI on him sort of once a week to evaluate the evolution of it, and this looks substantially better than it did last week, so that makes me very happy. And the patient is improving sort of by leaps and bounds. That's really great. That's really great. And once we've got the list together, we go up and start seeing patients. I always knew that I wanted to be in a mid-sized hospital. I think that hospitals run on personal relationships. Is that really Bridget in there? That's awesome. I did my neurology residency at Yale New Haven Hospital, and then I came down to do a 2-year neuro-oncology fellowship at the NIH. I realized pretty early in that fellowship that there are already too many neuro-oncologists in the country. And also that what I really liked was the hospital-based environment. So again, seeing lots of different things, seeing them at a fast pace, and having brief, intense relationships with patients and their families, and that was really the most satisfying part of medicine for me. We got a stroke alert downstairs, so let's head down to the ED.
Okay.
Is it okay if I take the stairs?
Yeah.
When you're having a stroke, every minute that goes by, you're losing about 2 million brain cells. So everything in the terms of treatment of stroke is directed to making sure the treatment happens as fast as possible. Around the state, the median time for patients in Maryland is about 48 minutes to get that medicine from the time they hit the door to the time that medicine is in their bloodstream. Here at Shady Grove Hospital, the median time is 33 minutes. All right, so we can save you 15 times 2 million, so that's 30 million brain cells. If you're having a stroke, go to the nearest hospital, call 911, don't try and drive yourself to the hospital. But I think if you're in the community, you can be really proud that our hospital is providing excellent stroke care. Hey, good morning, friend. I'm Perry Smith, I'm a neurologist. How you doing? So. You got a headache right now? Nah, let me put you with your patient and see how you're doing, all right? Tell me how old you are. Good, hold your arms out in front of you like this, like you're stopping traffic. Let's get a scan of your head, let's check a Depakote level, and we'll see what's what, all right? It's good to see you, I'll see you in a bit. All right. Okay, so I was just there for the stroke code that just came in now. Not gonna be a candidate for TPA, which is good. We're gonna get some scans and see what's what. And the stroke code from earlier this morning, the husband's here to clarify a little bit more about what's going on. So we're gonna bring her in, we're gonna be doing more tests on her as well. Hey, Terry, how's it going?
Hey, how are you?
Good.
What's happening?
Not too much. Can we run through the patients?
Yeah.
All right.
Stroke office, this is Terry.
I've been in this job for 8 years almost. We just received our Joint Commission designation as a thrombectomy center. Dr. Smith really led the charge with that designation process. I've been telling him this whole time that I don't think I could do my job without him leading our program so well. He's a great leader, great educator. I just feel very fortunate. Everything else is good?
Perfect.
All is well. Awesome.
There's one case from just a couple of weeks ago that was, it's one of those cases that's just like so satisfying, right? We had a very young patient. He was a professional musician, very young man, and he came in and he was clearly having a stroke. And this was a big stroke. If we didn't manage to treat this stroke, it would have been probably a fatal event, and certainly, he would never play the viola again. Like that wasn't even conceivable. And thank God we were able to treat him really aggressively and really quickly. And he had just an amazing, amazing recovery. And he came in on a Thursday. He wasn't able to play that weekend, but by the following weekend, he was back performing. Dr. Olin, who's one of the interventionalists, says, "We reached into the grave and we pulled him right out." So you have a case like that, and it's really satisfying. So that's one I think about a lot, yeah.